I would like to invite you again, Dr. Judith, to FurHour Talks, and thank you for your time. I know you have a lot of, a busy schedule. You are into so many research and everything. So I really, really thank you for the time which you have taken out for us.
Hey, I'm very excited to be with you.
So, well, you had told me that, you have treated 100,000, around 100,000 animals. You have worked with exotic, small, uh, large animals, everything. So, could you tell me how your journey began? What inspired you to get into this?
Oh, actually, it's interesting because the end result is me becoming a veterinarian, but that's not where I started. I mean, I'm from Montreal. I lived in the city, buses, metro. I was downtown, loved the active life. But every summer, my parents sent me to summer camp, and I felt like I could decompress when I was back in nature, and I was happy to be in nature. So I knew I was going to work with animals, but I didn't know in what regards. And I started at McGill University, actually in agriculture, which was around Montreal. So I started in agriculture with a little bit in zoology and loved it, and ended up doing a master's on bighorn sheep here in the Canadian Rockies. So the veterinary world was not on my radar yet. But when I finished my master's on bighorn sheep, which was amazing and lots of fun, then the reality of life really kicked in as a woman. Now you're like in your 20s. It's like, well, do I do a PhD? Do I have to move to another city? How, if I want kids, how does that all work all of a sudden? And it was really difficult to get work in wildlife biology. So I took the practical option, which was not my first option, and went to vet school. And I'm thrilled. I thought I was going to last only 5 to 10 years at the most. And in the end, I ended up owning my own vet hospital for over 20 years, and I've been at it for over 30 years. So it was fantastic. It was a great journey.
I also see here that you have founded Dogs with No Names, Pearls 365, and Larkspur Wildlife Sanctuary. Tell us about it because I'm really anxious, like I'm interested actually to know about these things.
Yeah, how does all come together, right? So,
Yeah.
and actually before that, I worked on ostriches. So there was a big ostrich market
Oh.
in Canada, believe it or not. And because I had worked in zoos, I'd worked at the Honolulu Zoo, I worked at the Calgary Zoo, I was into wildlife. So I got into ostriches. And the idea I worked on ostriches, I was the only vet that wanted to do this work. I had taken $1 million in liability insurance because this was a new field of medicine. And I did really well. It turned out to be a very good experience for me. And it was actually, I worked very hard, but I did make some money and I was able to buy land and build my own vet hospital, which comes to the point my vet hospital turned out to be just across the highway from a First Nation community, an Indigenous community, where there were lots of dogs running around. And they were getting hit by cars and they were in porcupine quills and they always ended up at my clinic. And then, of course, nobody would pay those bills because I would say, well, whose dog is this? And it always came up, oh, this dog doesn't have a name. It just got dropped off. Somebody picked it up on the side of the highway. So I was stuck with all these dogs. So I call them, oh, another dog with no names. And I figured, hey, we need to do something here. Like there's just too many of them coming to the clinic. And I treated them all. I mean, every single one got treated. Even though it didn't have a name, it's going to get treated. But it's like, we got to figure out what's going on. Like, this is not normal. So I started a project called Dogs with No Names, which was the first time in the world that we were using a contraceptive implants, which were used in zoos because I'd worked in zoos. I was aware of it. So use a contraceptive implant, so non-surgical, to help the overpopulation of dogs. So it was great. But I had to finance that. And through a couple of friends that were pilot and flight attendant, I ended up in Shanghai and I bought a bunch of pearls, freshwater pearls in Shanghai, brought them back and sold them all and used the money to finance Dogs with No Names. So then I went back again. I became a gemologist. I went to California and passed the certificate to be a gemologist. I knew about pearls. And I ended up donating to do the proof of concept of the contraceptive implant well over $100,000. I've put on all these Indigenous communities well over 100,000 pounds of dog food to help all these dogs. And then we had PetSmart Charities came on board. And then once I had proof of concept, help. And then I have bought another piece of land because I had donkeys. And the top of the piece of land has 100 acres. It's intact grassland. And I want to make sure it stays as a wildlife sanctuary because there's a lot of agriculture around us. So I'm organizing that land now to be a safe haven for wildlife. So where, grow where you're planted, wherever you are, find solutions that works.
So, this wildlife sanctuary, the Larkspur, if I'm pronouncing it correct,
Yes.
wildlife sanctuary, this is in Alberta?
Yeah, so I'm just at the base of the foothills, and larkspur is a wildflower. So this is intact grassland. So we're in the subalpine region here. So there's a lot of alpine flowers, and one of them is larkspur. So that's why I call this area. So we have 100 acres that we're keeping it off. No agriculture. Let's just keep it for wildlife. Lots. I mean, the diversity of animal is great. I'm trying to create an ecosystem around a pond as well to plant trees to bring more animals to it. So that's my endeavor for the next 5 years where I am right now.
Wow, amazing. And you have also worked, as I said before, with small animals, large and exotic animals. So, how did the diversity influence your practice today? How is that, how it has influenced you today?
You know what? It was, I mean, on two levels, it did influence me.
Hmm.
Certainly, like we have a frame of reference for everything. So we know when we rescue our dogs, they may have been like, for me, they come from a First Nation community that spoke only Cree, had only caribou and wolves and bears. And you bring them into this area and they see so much more. Their frame of reference is very small where they came from, and then we're bringing them elsewhere. So it's really hard to adapt. But by doing so many different things, your frame of reference gets bigger and bigger and bigger. And therefore, it's easier to connect the dots and find solutions to everything. It makes you more resilient. So to me, that's why, like all the different programs that I'm doing, it just gets easier because you can always go pick something from here. Whereas if I'd stayed for 30 years of, which is admirable, but just doing small animal medicine, just one thing, it doesn't give you the broad perspective. And I must say, doing things like Dogs with No Names, the Larkspur, it gives soul to my work. I mean, the veterinary medicine is my paid work, but this gives soul to it. And it fuels a fire because the rest can become repetitive a little bit.
So, coming to a lot of programs which you have designed, even you told me there is a program which is under construction, the program.
That's
So
right.
could you, yeah, so could you tell me something about program? What does it stand for? What is it? I'm excited to know about it. What is
Yeah,
it?
so HUM is HUMM, which interestingly is one of my other projects as well that I'm doing here is beehives. So we have 20 beehives under Bee Cube and doing lots of research on how to help pollination and everything. So humming, busy like a bee here humming. But HUMM stands for Humans Understanding Mindful Medicine. And to me, I'm creating a paradigm shift here in pet care. We know, or we should feel that the role of pet guardians is one that should be now very informed, intentional, and present because the world has changed. The world of veterinary medicine has changed. There is consolidation of vet practices, there's protocolized medicine, there's huge costs, affordability of care. So we have to be mindful of your dog, and we want people not to be passive consumers of veterinary services because
Mhm.
most pet owners can't afford everything. So we know having a dog is one of the greatest joys that we have in life, but it comes with responsibilities. And that's why we can't be passive. It's about becoming the human your dog deserves. Like you are the protector of your dog, you're the historian of your dog, you're the advocate for your dog. So it's to help you become that. And of all the species that I've worked with and all the species on the planet, dogs is the species that cannot fit one size. Like one size doesn't fit all. Dogs are
Okay.
fully our creation, right? There's no other species that has been so manipulated that we have a Chihuahua, we have a Great Dane. They mature even at different time in life. Like a Chihuahua is a mature dog at 6 months, a Great Dane is a mature dog at 2 years. Like there's so much diversity that we cannot have a one size fit all medicine. So the program is about empowering pet guardians to be informed, confident, present for their dogs. And I'm talking wellness, not just health. It's wellness, more holistic.
You see any sort of knowledge gaps? You have observed any sort of knowledge gaps among the pet parents?
Yes. And I think, and the knowledge gaps, or
Mhm.
what I'm trying to say, the knowledge gaps are inevitable here. And there's knowledge gaps in veterinary medicine as well. Because if I look at 30 years ago when I graduated, we didn't have access to an MRI, we didn't have access to CT scans. We did X-rays by dipping them. Like we didn't have, we dip them
Okay.
in the tanks. We'd go do a horse, we'd bring 8 plates and come back, and the clinic dip them. We did not learn about dentistry. So look at all the knowledge we need to have. And as veterinarians, we're still learning in vet school to deal with pigs and horses and large animals. So there's so much more technology. There's so much more medicine, if you like, available. But us as veterinarians, we have still only 2 years to learn everything about small animals. And of course, as a pet guardian, you know you have all of this is accessible. So it's about empowering, like, and it's not about knowing everything, but it's having a framework, a tree of decision of how to think about this and have a roadmap. This is how I'm going to look after this dog, the dog in front of me.
As you said, that this program will be focusing on mindful approaches towards your
Yes.
pets, basically. So, how does, let's say, we were discussing prior to this, that time you had told that a lot of upselling is also happening in this market.
Yes.
Uh, yes. So, how does this program will help in that?
So upselling is you need to know, so you need a roadmap of what you need for your pet. And to me, for example, I'll take an example out of nowhere. You walk into a pet store and I said, I need pet food. Is that an empowered pet guardian? No. What do you mean you need pet food? My dog is this kind of dog, and my dog likes this kind of protein, and my dog likes this kind of food. So we need to be able to develop our abilities of how to think about problem. So to prevent upselling, I mean, if you want to be super simple about upselling, like we could spend a whole hour, to me, always be aware on the just in case. We should run this test, we should give this medication, we should do this just in case. So that's always a red flag. And also go with a KISS principle. Keep it simple, right? So if we're upselling, like to me, if you go home and you've got like 5 different medication for your dog, all to be given at once, it's like, oh, that's a lot. Like, can we keep it simple? Hopefully the upselling is not done intentionally, but it's because it falls under the protocolized medicine. And that's where as a pet parent, you have to learn to be high agency. That is your self-defense against protocolized medicine. Your dog is unique and it doesn't fit in a protocol.
How the pet parents can identify at their level that the upset about the upselling, how they can identify that at their level without approaching a vet or any sort of an expert.
And I mean, it's to me, it's the same as me when I go to a human hospital. It's like, are we going to do all of that? By the time I come and I'm in front of that situation, it's a bit too late. I should have been prepared before I come. And now I can spot and I have anchor points. So to me, it's like you have to learn a little bit about what is going on. To me, I mean, again, to keep it very simple, the upselling, it's always to ask me, there's always 2 magic questions as well to detect upselling as well. And we talked like just in case, but the question is why? Why am I supposed to take this? And the next question is, well, what if we don't? So your pet needs 6 vaccines. Oh, why? So in Alberta, for example, we don't need leptospirosis. We don't have it. But if you travel to Quebec all the time to another province that has it, maybe you do need it. So why do I need the 6 vaccines? I should be able to tell you exactly why you need leptospirosis, why you need coronavirus, which again, we don't need that unless you were in the show ring, but the parvovirus will be doing some cross immunity there. So always ask why, and I should be able to answer why for each one of them. And then it's like, well, what if we don't? Like, what if we don't leptospirosis? Well, actually, nothing's going to go wrong in Alberta because we do not have leptospirosis. So if anything, if we want to be, like, to me, be prepared before we're put in front of a situation. It helps a lot when you have a lot of anchor points, and we have done a lot of research. But otherwise, it's those 2 magic questions. It's why and what if we don't?
So, this hum program will help the pet parents to identify these kind of gaps. At
Absolutely.
least teach them.
Yeah, so I mean, so the hump program at the end, it's like 6 modules, but at the end, it's to build your own roadmap for your dog. And if you have 3 dogs, they're going to have 3 different roadmaps. Not one dog is identical to the other. So, what kind of pet parent are you? Are you an anxious pet parent? So, first, the foundation, like, are you an anxious pet parent? I can tell you if you're an anxious pet parent, don't choose a vet that's also super anxious. That's not a good mix. You need a vet that's super confident that, like, no, we're good. So first, know your foundation is what kind of pet parent are you? What are your financial abilities? I mean, if you get hit with a bill at emergency with $20,000, are you going to hyperventilate, or are you going to go like, hey, I got this. I know how to handle this. So the foundation is you as a pet parent. The other foundation is like, who is my dog? And to me, there's nothing more that I love, Rajvika, when a client comes to the clinic and their dog is sick and says to me, you know what? The pulse is at 144, and the breathing rate, like the resting breathing rate, is over 30. It's like, wow,
Right.
we're moving fast and we know where we're going. So to me, it's about empowering. So pet parents need to be able to do those things. I need to be able to take basic vital signs on their dogs. And then we go through how to find a trusted vet, how to negotiate with
Mm.
your vet team, because when it's time to get a second opinion, what if you can't afford a bill? What if you disagree? How to approach this without being confrontational? How to manage chronic conditions like your allergies and all that. That's one management. How do you manage emergencies? Do you sit? Do you monitor? For how long? Or do you rush to emergency? You need to know those 3. You need to know that right off the bat. So those, we're going through 6 different conditions like that to help. And at the end, we also create a health story for your pet. You need to know your health story. To me as a vet, it's really difficult when I say, hey, we should put your dog on Deramax for pain killing. And it says, oh, my dog has been on that before. Oh, that's great. Did it help? And they go, oh, I can't remember. Well, I need
Okay.
that information. Like, did it help or not? Because if it didn't help, we don't need to go there again. So to me, we need to create a health story for your dog, and the different medications and what was the outcome of each medication.
Another most common question which the pet parents have, they get confused, is with the insurance.
Oh, that's a big one.
Yeah, that's the new trending thing which is coming, is the pet insurance. So now, how do the pet parents mindfully consider which insurance, what to take, how they can understand that, how they can learn about it?
You know what? This, we'll have to connect again and do a full hour on pet insurance if you like. It is
Well,
that complicated.
you can just give a gist in this one.
Yeah, it's just so. And at my clinic, I had a manager just to deal with pet insurance. But to take it simple for now, pet insurance are evolving all the time as well. All the different companies are changing all the time. So when you go for one today, in 6 months, they may have a different business model. So be aware of that. So there's a lot of fluidity in that. If people get a puppy, my reasoning often with the puppies that are at risk, like the golden retrievers, the Bernese mountain dogs, they're going to get in trouble before a year of age. I can tell you that. You're going to be back because they did dietary indiscretion. They ate something they should not have eaten. They have vomit, diarrhea. Like, those dogs I always see before a year of age because they got in trouble. My recommendation is, when you get a puppy, if you're looking at insurance, get it right then before we find any complication with your dogs, anything that will raise a red flag. Like, don't tell me it has an itchy ear, because now that has to go, and it's going to be on the insurance form. So like on the first exam, if you're contemplating it, and a lot of the insurance companies will give you a month. So to me, for the first year, and then you find out what kind of puppy you have. And if you find, oh my God, this puppy has been at the vet 3 times already before a year of age, maybe it's a good idea for you to keep pet insurance. If your puppy is super good, your dog never runs away, he's just the ideal puppy, then you can consider whether you want to continue after a year of age. The other big consideration in insurance I find with people is, look for catastrophic. Are you looking for catastrophic? We got hit by a car, we got into a dog fight, we have a seizure, something catastrophic. You need insurance for that. And definitely not for including all wellness. Like, if you need to pay yourself for wellness exams, vaccines, dentals, don't have that included. in your insurance unless you want to pay huge premiums. So that would be another one. Like, are you looking for just catastrophic? And then, I mean, the more we wait in age, I mean, the companies will accept in general all animals, but it's just your premiums or your deductibles will be so high, and there'll be a lot of conditions that are excluded. So it gets more and more expensive. But it is, I mean, it's at the point we need like an hour to discuss insurance alone. And of course, veterinarians are not specialists in there.
Let's get on to your specialty is surgery.
Oh, love
Is
that.
so you have like I think so more than thousands of procedures you must have you must have gone through, like you would have
Yes,
performed.
yes,
Uh, so let's get on to the surgery. What
yes.
is the most common fear or questions which the patients have come to you before surgery for their pets?
The most common questions?
Yeah.
Yeah, well, definitely how much it's going to cost. Because when we go to surgery, we're usually not talking a few, like $100 or $200. Like if I'm talking in Canada, to put an animal under on an anesthetic machine, like once we put them under an anesthetic machine, that's right off the bat to start will be $250 to $300, and we haven't even touched the animal like for surgery. So one of the first question is how much it's going to cost, and then be aware. Sometimes it's very easy to give, like all the we call them the shuffleable surgeries, like the spays and neuters. People can phone clinic to clinic. Those are easy to estimate unless there's a complication. So those we can give great estimates on that. If I had a 10-pound tumor on a dog, I don't know if it's going to take me 1 hour to remove or 2 hours. So then we give an estimate at the low end and the high end, and then you should be within 10% in that estimate. So certainly how much is going to cost. Can my pet die? So that's unfortunately a big question. And
Mhm.
often it's asked from people that have had an unfortunate accident before. And surgeries should not be taken lightly. And it's the same to me as dental and dental cleaning. They're going under anesthetics. Those should never be taken lightly. So that's understandable. Um, for me, surgery has been very successful in my 30 years. And back in the days, we had no monitoring, like we were just a vet alone in surgery doing our own thing. I've lost only one pet in my 30 plus years, and that dog was already 15 years of age, removing a big tumor as a last ditch effort, and died on recovery. Like, so to me, surgery has become very safe, but never flippant about it. And when I'm surgery, nobody talks. I don't even have music. Nobody talks unless it's what's needed. I concentrate on every single surgery, including routine surgery. So probably those would be how much does it cost, and how hard is it going to be on my pet, and will my pet wake up, would be like the two comments, and they're fair questions.
And about anesthesia. So the modern anesthesia. So is it safe for pets?
I think,
Okay.
or the, yes. So to me, and again, I'm never flippant. We have, in the old days, we would use like two drugs, three drugs before we would intubate them and hook them to a machine. Today, we can use, my protocols was on average 7 drugs before we hook them to a machine. So what we're trying to do is take the best of each drug without the
Mhm.
side effects. So before we would use things like acepromycin, which was a bit of a sedative, like boom, and we drop their blood pressure. And my God, it was just so hard. Now, I mean, if I were to use acepromycin, I would use just a little bit, because I'm going to use a little bit of this, a little bit of this. So I find it's a lot safer, because we're trying to get the benefit of several drugs without their big side effects. So that makes it safer. Plus, now we have so many different protocols. We'll have a protocol for a seizuring dog. We have a protocol for a cardiac dog. And before, we didn't do blood work before going under anesthetic. So we got under anesthetic. It's like, oh my God, there's a tumor on the liver, and nobody knew about it. Now we're taking under anesthetic less and less patients that are like, ooh, there's a surprise here. So to me, but I mean, there's human errors that can happen, but we're in a much better place today compared to even
That's
20,
good to hear.
30
That's
years.
good to hear. How do the pet parents, how do they prepare their pets emotionally or physically prior to getting into a surgery?
Yeah, so there's that's a very good question. So first, follow the instructions. So
Okay.
Definitely don't fail your pets, follow the instruction. So if I say water is available at all time until the time of surgery, please make sure there's water available. I don't want a dehydrated dog under anesthetic. So follow the instruction that says water available all times. If we say, hey, food must be removed at 8 o'clock, please don't give food for breakfast. I know your dog wants food for breakfast, but now we have a problem. We may regurgitate during surgery, aspiration, pneumonia. So follow the instruction to a T. That will help. On the physical side as well, this is a pet peeve of mine, and I deal with it. Make sure your dog goes for a walk, little walk before coming to the clinic for surgery, because it's nothing bad like opening a dog and it's like, there's a big bladder in the way. Like,
Oh, okay,
not going
okay.
to repeat because now we got to deal with this. I cannot go surgery. So now it's like, oh my God, we got to empty the bladder. Or I mean, there's a big colon, like you got this big tube in there that you're trying to work and push around. It's like, didn't this dog have a chance to go? Plus, when they recover, they're very uncomfortable because now they've already spent like half of the morning in the clinic. They got a big bladder and lots of poop in their colon. So to me, my pet peeve is like, please make sure you walk your dog before coming to the clinic so it can evacuate that. It makes the surgery easier and it's more comfortable for them. Emotionally, I know it's hard because the dogs know their routine is changed right away in the morning because usually we say no food. So their routine is changed. So there's something going on with them. At my clinic, I was lucky because we had a lot of space. And if people said, can I stay with my dog until my dog goes to surgery? Because often we'll bring them in early because I'd like to do blood work right before surgery. So I know what's going on right now. So for low blood sugar, I know now, not from a week ago. So to me, we had lots of room at the clinic, and for a lot, well, probably pretty much everyone, we were able to say, yes, we're going to do our sedation, we're going to take blood, and then you can sit in a room with your dog until we're ready to go to surgery. So, I mean, if the clinic provides that, I think it's really awesome. And then on recovery, again, some people will go for coffee, and then we call them and say, hey, we're just extubating now. So if you want to come in about 15 minutes, you can be with your dog who is not even quite awake yet. So if a clinic is able to accommodate that, I think that's really helpful. Sometimes it's not possible, but that helps a lot. And the sooner I can return them or have their parent with them, I think it's very helpful. It must be so disorientating for dogs, what's
Mm,
going on in there. And they hear brand new noises. I mean, we make noise in surgery, we're moving instruments, we're moving equipment. Everything is new to them. So to me, as a general rule as well, to make it easier for them, I'd like them sedated quickly. When they arrive at the clinic, I don't want them anxious for 2 hours. It's like, let's give them a sedation so they're already like nice and relaxed about it.
Post surgery, like you have seen any top mistakes which the pet parents always do? They can
Yes.
avoid unintentional. They are obviously.
Yeah. Uh, so yeah. Yeah. So the big one. So, and of course, it's always the same thing that comes over and over, and it's all done with good intention. Um, It's traumatizing an incision wound. So wherever the incision is, no licking and no scratching. Like number one, top of the list. No licking, no scratching. So that means a dog may end up having to wear a cone, may have to wear a t-shirt. I'm a big fan of wearing t-shirt, may have to wear a sock, but something because people say, oh, my dog just won't lick. And then it's like the next day, like the suture line is wide open. It's like, no, like, that was so no licking, no scratching is my big one that, and we highlight it on paper, like no licking, no scratching, traumatizing the incision. And then number two is really follow the instructions about exercise. So if I do a big dog spay, which are difficult, 150 pounds, and it's a mature dog, bleeding is an issue in those dogs. And they go well 99% of the time. But one of my big one is when they go home, we don't move. Like you'll take her out for a little pee and poop tonight, and then we don't move for 24 hours because we need all the blood clots to really take in. So yeah, don't let your dog go play with other dog. Don't let your dog go like, oh, just chase a squirrel. It's like, oh no. So also like limit exercise after surgery would be also another big one. So those would be the two big ones is like follow the instructions, post up, but mostly no licking, no traumatizing of the wound, and reduce exercise, like follow that to a T. I mean, some surgeries are super minor and we put a bandage and
Mhm.
that's hey, full exercise, but really be mindful of that.
And when should the pet parents seek second opinion if
Oh,
they
that's
want to see?
Yes, so seeking second opinion. So it all depends. If you're dealing with a trusted vet, it's been going well, and all of a sudden things, it's like, no, this doesn't jive. You're not. I mean, sometimes a vet can miss completely. So it depends if you're tired and you figure, okay, we are not communicating well, and you want to change completely, or it's just on this issue, I don't feel we're getting it right. And then to me, it comes to trusting your guts about it. So when you find like I've got a problem, let's say you're dealing with allergies, and it's like we're going in circle. We're just going in circle. We're spending money. We're trying different foods. We're trying different medication, and there's just no plan forward. I don't see. So those would be when your guts are saying like this is not working out, and there's no results, and maybe my vet is not hearing what I'm saying. And sometimes it goes both ways. So then it may be good to just go. And it depends if you want to see a specialist, you would need a referral at that point. So that's a different conversation. Or you may just like, I just need to be safe on this. I just want to go see another vet. And maybe the other vet is going to say the same thing, but then I know I'm on the right track. Which brings me to the program and having a health story. So my
Okay.
recommendation is you never leave a vet clinic if you've had blood work done, if you've had x-rays done, if you've had histopath done on, biopsies, you always get those records with you. Always.
Okay.
It's part of your
Okay.
health story. So, and an x-ray to me, anytime I would take an x-ray, I would invite the owner back to look at the x-rays with me. And I'd say, hey, take your phone, put it in landscape here, and take a picture of the x-ray and make sure you have the date at the bottom. So they have with them on their phone always available, because sending the records with x-rays can be more complicated. So to me, when you seek a second opinion, let's say I am the vet now that you're coming to for a second opinion. It's like, well, have you had blood work done? Yes. Okay, well, I'd like to see that. But then if you don't want your regular vet to know, you have to ask to send all the records to me, for example. But if you have the health story with you of your dog, you say, oh, yeah, I've had blood work done. So here's the blood work. Yes, we've had x-ray. Yeah, I have all that with me. Then the second opinion can be so much better, because right then and there you arrive prepared, empowered, intentional, and present.
It's very important, you said, like, no, that the x-rays and all, they have to be whenever you want, whenever you are at a clinic or something, when you're going to a vet, you should always keep the documents and everything with you. So you said it's very, very important. So in that particular sense, I had told you, like off camera, I had told you about this thing, that we have created an application which is FurHour. It's available on iOS. It's available on Android also. So we have kept one feature in that as a pet documentation vault, wherein all the scanned copies, pictures of all the documents and everything, they can load it and they can carry it in their phone everywhere. What's your take on that?
That's excellent. That's excellent. That should be now routine. Like for me,
Mhm.
it should be, and the reason for that, again, we're talking that that landscape has changed. So often when you go to a vet clinic, you may not see the same vet all the time. Like even if you go to the same clinic, maybe your vet work only 2 days a week, your vet is sick, you go to emergency, there are usually 2 or 3 shifts a day. So who's in charge of holding all your records? It's you. You are empowered as a pet parent. So to me, it should be automatic. And I mean, and so yes, as part of your app, and then maybe the roadmap that I'm putting together can be on your app as well, because it'll go way beyond that. But those are the
Yes.
basic things that when you go see a veterinarian, as part of the health story, we need to have. And I want to see, because often if people say, well, I had a biopsy done and this is a result. Well, the result is more complicated than that for me. Like I need to see all in between the lines that for you, it may be a mast cell tumor. But to me, it's like, well, what great mast cell tumor? How well was it excised? Like I'm looking at far more. So that's why I just think it's great that you're putting that on your app. Great resource.
Actually, this thought we got on the basis, like, see, when for humans, as in if I'm going to a doctor, if I'm going for my checkups, my regular checkups and everything, so I have records with me, and I generally carry all my records. So it's in the same sense I got it, that if I'm doing it for myself, then why not we should do it for our pets also, because they are also going through the same things what we are going through.
Absolutely. And again, it's because we're not seeing, like, if you only see one veterinarian, I've been in the same clinic for 20 years, I work 5 days a week. Well, you're likely to see me all the time and I have full continuity. But if you do not have that, if you are in charge. Now, certainly in all of this, I'm talking about all the diagnostic results that you need to have. Be aware, for example, someone like me who has just gone to surgery, I've just finished 3 surgery and I'm behind, I'm going to rush into my first appointments. You will not find my medical notes right away when you leave the appointments. That's not what you're going to get available, because I may not write my notes now until 5 o'clock. It's just we're rolling one after another. But if we've done x-rays, blood work, ultrasounds, all of those things, that's independent of me and that should be with you. And that's hugely helpful.
There is one more very sensitive question, which it's 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 actually hard for me to tell it out. Also, I'll read it out to you. It's very sensitive. It's about euthanasia. So, how can a pet parent recognize when it is the right time, and what guidance would you offer to help them navigate this moment with compassion and clarity? I
Um,
wanted to read this out to you because I wanted exact words coming to you.
yeah, that is it's so difficult. And again, and that's part of the program. There, like, one size doesn't fit all. But I
Yes.
have guidelines. I have guidelines for people. Definitely, when it comes time to euthanasia, we never know when it's the perfect minute. The two most common complaints, and I think that will help people, the two most common complaints I've heard from people going through the process over the years is, I waited too long. We had a diagnosed condition and I waited too long. So let's say we were dealing with bone cancer and keep going, and the dog did something and broke a leg, and now it's an emergency. We need to have the dog euthanized. He's in so much pain. Like, we waited too long. We knew he had bone cancer. We were in pain and we waited too long. So that's number one. Number two, if it helps, some people, like, the animal is not doing well, a 15-year-old not doing well, not sure what it is, and they said, well, I think it's time for euthanasia. And I said, hey, do you want me to run some blood work? Or I think it may be this. Should we run an x-ray to have a look? It's not going to change the outcome, but you'll know why we're calling it a day. And so the number two complaints I've had from people is like, you know what, I was really upset I had my dog put down, but I actually don't know why I did it. Like, I don't know if it was the right decision because we didn't know what was wrong with my dog. So certainly two things to avoid for people going forward. And to me, the guidance in helping and it's deciding about quality of life. I mean, there are two things that I look at if we want to go on the objective side. And that is, what are the 5 things my dog likes to do? Not your dog, not any dog, but what 5 things my dog likes to do. So if I pull a leash and my dog is all excited, and I mean, could be lame and all of that, but excited, I pull a leash. If I get a treat, my dog is excited. When I come home, my dog is excited at different levels. So look at 5 things your dog likes to do, and is your dog still able to do them? And if it's like, now you come home, never mind your dog is dead, but it sees you and it puts the head back down again. Well, it must be in a lot of pain because your dog would want to be greeting you. So look at 5 things my dog likes to do, and are we still doing it? And then the other guideline, and I have one more after that to help people, is we need to have more good moments than bad moments. So people will say, oh my God, Judith, you should have seen, we went to the dog park on Sunday. Oh, he had such a great time for half hour. But yeah, but now he's sleeping for the rest of the week. Like, every single day we're sleeping. So half hour at the dog park on Sunday compared to 6 days and 23 and a half hours of not getting off the bed that's not a lot of good moments compared to bad moments. Also, there's a great resource by the Lap of Love, by the way, that helps people to go through all of that. And then make sure your final moments decide what will be best for you and your dog. And for some of them at my clinic, I was really lucky. We had 24 acres. People could go outside, put a blanket, and we would go and do it outside. There are vets, we can go to your home and do it in your home. Some people don't like that because they say every time I go back in the living room, I think of my dog, and that's where we put my dog down. So make sure that those final moments are well prepared for you, and you give a heads up to the clinic of how you want this to happen. And if I may, is do not be separated from your dog at the very end. Stay with your dog at all time. If the team says, oh, we need to put a catheter, we'll take your dog in the back. Like, no, I'm going to stay with my dog. Like, to me, never separate a dog from their parents in those final moments. Always stay with them. And if a clinic says, no, we won't, find a vet. There's lots of vets that will make sure that you won't be separated.
Even the clinics, do they provide a coping mechanism for the parents? Because once their pet, their dog, it's like their child actually, so passes away. So do the clinics do provide some coping mechanism for the parents also, like afterwards?
No, so in general, no, and this is where we're lacking compare for human medicine as well, right? If you have you're in the hospital and you pass away, your regular doctor, I mean, they got to bring a team to help you
Yes.
in social
Yes.
work and all of that. Your doctor, your surgeon, your oncologist is long gone. That's not their wheelhouse. In veterinary medicine, like we're doing this as a vet, we have a 30-minute appointment, and oh my God, it's validated grief. And often pet grief is not validated. Oh, it's just a dog. No, it's not. It's so much more. So this is usually every clinic has access to a counselor, a
Mhm.
certified counselor, and a lot of pet insurance, human insurance, like, part of work insurance will cover that as well. So to me, we always have on hand, it's like, hey, if you're having a hard time, we've established a relationship with a certified counselor to help. And there's pet loss group if you don't need as much, like just a little bit of support, or counseling, which is more like therapy. But yes, we need to provide a lot more, and we're behind in veterinary medicine compared to human. Yes, it's not validated enough, and it should be.
Right. Let's move on to little fun part now. Let's bust some myths. Okay,
Yes.
so I'll just say a few of the myths, which even I must be having some of the myths probably. So one is raw food is most natural and therefore it's the best diet. So what do you think about it? Is
Ah.
it?
Oh, that's such a trap. Well done. Um, So to me, I have a problem with every pet food right off the bat, every
Mhm.
single one of them. So there is not one that trumps the other one. And to me, the best answer, and that, again, that'll be in the program as well. When you come to, like, you should not walk in a pet store and say, hey, I want to buy pet food today. Like, you should know. So do you want your food safe, nutritious, convenient, or affordable? And you cannot have all four. You need to prioritize one. You're lucky if you're going to have two. So let's say we take raw food. Raw food, is it affordable if you have two big mastiffs? Probably not. Is it convenient? No. Like if you live in an apartment, you may have to go get another freezer and all of that. So I'm not saying raw food is bad, but if your top criteria is it has to be affordable and it has to be convenient, well, that will kick that one out. For me, the top, I mean, those are important criteria for me. Safe is starting to be a big one because a lot of things that we do, a lot of food we have access because of pesticides and everything is not safe. So even if it's nutritious, if it's not safe, what's the point? So to me, safe and nutritious is way up there. So to me, in everyone, there's something good. In everyone, there's something I'm not happy with. So it's a pain gain scenario that you have to run for yourself.
And but for the pet, is it okay that we give raw food, or we should give the cooked one, or shall we give the packet foods which we get it outside in the market?
Oh, like already pre-cooked in a package in the fridge?
Yes, yes. The
Not my
pre-cooked
favorite.
ones, or giving them the treats, too many treats or something like that.
Yeah, not my favorite. If it's pre-cooked in a package, I'm far more concerned because there's less chain of custody compared to human medicine to end up with E. coli and all of that. My favorite, and I say my favorite in terms of watching pet parents over the 30 some years, which ones have done the best probably would be the ones that are doing a lot of home cooked meals. That's
Mm-hmm.
what I've seen. They've done very well. And the home cooked meals have been in about one third animal protein, one third a carbohydrate, just such rice or potato, and then one third all your veggies, your fruits, and everything, and add some vitamins and minerals to that. I've seen a lot of pets thrive on that. The raw
So,
food, so the raw food has benefits, but there's a thing with raw food as well, is that as you know, it's raw. And a lot of the animals here, anyway, in North America, come from feedlots, they're industrially raised. So there's a lot of fat because they're raised on grains. They're not free range and fed on hay and grass. So, you know, when you put a steak on the barbecue and it spits all over, that's the fat coming out. When you put a chicken in the oven, you roast a chicken and you end up with all the gelatin and all of that, the fat comes out. When you feed raw, the fat all stays in. So,
mm-hmm.
some dogs have GI issues. They can't handle raw food because the fat level is too high. Some dogs with allergies I've seen do beautifully with raw food because maybe they needed more fat in their diet. So to me, again, it's a mindful, like the dog in front of me, how do we thrive best? And of course, there's always a concern for contagious disease, obviously, when we're dealing with raw food. It's always been there, but it's also a little bit there with other food. But when you cook it, you don't have the problem.
And how about vegetarian food?
Well, I mean, yeah, I mean that's the thing in like in India when we're talking vegetarian and working with street dogs, and then we get into the vegan food. I'm not a fan of dairy, so right off the bat, I am not a fan of dairy for pet food, and the reason
Mm.
for that is dairy. There's a reason. It's number two allergens, so it's like, ugh. So beef, dairy, chicken in that order for us in North America. Beef, dairy, chicken. So dairy is number two, and we don't have a lot of food that are well, we don't have any pet food commercial that are, cheese base or dairy
Right.
base. So to me, I'm
Mhm.
not a fan of giving anything dairy because it's your number two allergen. So why tempt the
That's
devil? Like,
actually my next myth. Is
oh,
milk okay?
well, I mean, and plus they do not have, I mean, once you're weaned, you lose a lot of the ability to produce lactase to digest. So to me, it may work, but if it doesn't, again, it's a pain gain scenario. And if it
Mm,
doesn't work, ugh, there's a lot of issues with that. So vegetarian to go on dairy, just because it's the number two allergen.
mm,
Why go there? Like pick one or the other. Go to chicken or beef. But even don't combine them because if they have an allergies, I'll never find out. Because if they're usually allergic to chicken, they won't be allergic to the red meat. If they're allergic to the red meat, they're usually not allergic to the white meat. So don't combine them. So people say, well, I buy whether it's kibble or raw or home. He says, oh well, one week I do chicken, the next week I do salmon, the next week I do beef. It's like, oh, if we have a problem with allergies, we'll never figure it out. So there's so many answers to that. And that's why we need to make a roadmap for your dog. And what works for
mm.
your dog may not work for another.
So let's go to the next one. Vaccines should be avoided because they cause more harm than good.
Yeah, it's a big, and especially after COVID, I don't want to really go there, but after COVID, there's a lot of questions are being raised. My stance is strategic vaccination. I mean, you cannot cross border without a rabies vaccines, for example. So if you go, at least do strategic vaccination. At least if I have a 10-pound dog, why would I give it like 5 vaccines in one go? Can we break them up? And we'll give rabies this week. And then next week, it's going to be the same price. We're not adding more to this. We're just going to give it time. And then next week, we're going to give parvo because your dog is going in boarding and they're going to ask for the parvo distemper vaccine. And because your dog is going in boarding, then we may need kennel cough. But the kennel cough can come in the nose or can come under the skin. Which one are you going to take? So to me, minimize. If you don't need vaccines, don't just take all of them just to be safe. Don't just, and I mean there's a lot of work to be done. Only take what you need to take for your dog.
This
And
also,
so
I guess, your thumb program helps them to understand, right?
Yes. And for example, when I work with dogs in First Nation communities, we have a lot of parvovirus, and then we vaccinate, and then we don't have the parvovirus issue.
Hmm.
Yes, we're going to give parvovirus, but your dog is 15 years old, it's a Chihuahua, and only walks in your backyard. Why are we giving your dog a parvovirus vaccine now? Like, no
Right.
reason. So it has to be super strategic.
Okay. The next one. All lumps in older dogs are dangerous.
Well, no. I mean, and I always tell people, oh my God, I'd be such a millionaire now if I removed every lump I saw in a dog. So I'd be so rich. So not every lump. And to me, there's a couple rule of thumbs right away. Like if it grows really big, really fast, we need to pay attention to that. And if it looks really inflamed, we need to pay attention to that. So to me, not every lump, but I mean, things like a mast cell tumor, which is the greatest impersonator of all cancer that is often on the skin. I mean, it's going to show up as just a little red thing. And a week later in surgery, it will have tripled in size. And then I can have a lipoma that's an inch in diameter that will never grow. Again, 50% of the lipomas, which is a benign accumulation of fat, 50% of them will never grow to be big and cause a problem. So again, it's discernment, but every one of them should be identified and say, okay, this is what we're dealing. But yeah, if it grows really big, really fast, we want to pay attention to that. And I mean, an abscess, by the way, can grow really big, really fast. And that doesn't
Okay.
need surgery either. Yeah.
Okay. So they should always consult. If they find a lump or something, it's safe to consult a vet um,
Yeah. And if
first.
anything,
Maybe seek a second opinion also.
I want a picture. Put your
Okay.
finger beside it and take a picture. And then you can every month, every year, then you take a picture and it's like, well, it's never moved. I mean, cancer, again, moves really big, really fast. So if it was like half a centimeter and now it's like 10 pounds, like we had lots of time in between to raise a red flag on this. But it helps to first, as soon as you find something, clip the hair, put your finger beside it just for dimension. It gives us an idea of dimension. So put your finger beside it and take a photo and start documenting. And some of them, the dogs are 15 years old. We've seen the same lumps in there for 5 years. They've never grown. They're warty tissue. So we don't need to go to surgery for every single one, but we'd like to identify what they are to remove the concern.
Okay. Okay. So if a pet is active, it means they are perfectly healthy.
That's on, yeah, I wish it was like that. So we can have a golden retriever with a big, what we call a hemangiosarcoma, which is a big
Mhm.
splenic tumor. And then all of a sudden it'll burst and then they'll die. But I mean, up to that day, people will say, well, he was doing great. A couple of times I found him quiet for a day or so, but then he was great. So that doesn't mean, and to me, it's the same, a lung tumor. The dog is doing great, great, great. And then it's coughing for a week. We take an x-ray and it's like a huge tennis ball in there. Well, that didn't grow just in the last week. You notice the coughing. It's been there for a year. So no, and that's where again we may want to start screen a little bit as a dog
Mhm.
gets older. We start to screen for things that maybe we can deal with sooner.
So even like how we go for our annual checkups and all the regular annual checkups, so we should take our pets also for regular annual checkups.
Well, yes, unless you feel confident, because, and again, an annual checkup to me, it's like really like nose to the tip of the tail, like handling everything,
Mm.
feeling all the lymph nodes, listening. And even my dog, I mean, one of my dogs that I had rescued, doing great. I went on vacation. I'm doing wellness. Went on vacation, so I had an vet working for me. And then she was just playing with Eddie, and she said she put a stethoscope to his chest, and he had like a heart murmur 5 out of 6. And it's like, what? Like, no, I've never seen that. So, I mean, between two wellness exam, like I did a wellness on him like 6 months before he was perfect, super active still. That's why to me, he gave no indication that, and now I
Mhm.
have a murmur 5 out of 6. So certainly it's nice to get some baseline, but how much are you doing of a baseline every time? Like, are you going to do blood work at each wellness exam? Maybe, maybe not. It depends on your conditions, like your financial conditions. It depends on the pets. Some pets would be a good idea, some pets it's not. So I think it's a good idea once a year to have a professional look and pick up things that the other vet picked up a murmur. I did not miss the murmur. You can't miss a 5 out of 6. But I would not have listened to my dog. It's just because the dog was new to her that she decided to do a fun physical exam and found that out. So yeah, it's helpful. I was
Okay.
grateful.
Okay. And surgery should always, the last myth, it is surgery should always be avoided unless it's the last resort.
Well, oh God, that's interesting. I mean, I'm not flippant about surgeries, and I'm not flippant about dentals as well, putting animals under for dentals. But if we have a painful tooth, we need to remove it. Unless it's the last resort. Yes, I know it depends what you call a last resort. If it's a mast cell tumor and it's a grade 2, doesn't need to be removed today, but it's going to be bad if we wait another year. So I'm going to do it today, even though we're doing great, to avoid something worse. I'm removing a lipoma today that causes no issue. That's 1 pound right by the elbow. Because if I wait a year, it's going to be 2 pounds, and it's going to be all around the nerves and the blood vessels, and I won't be able to remove it. So, but yeah, never be flippant. I mean, don't go to surgery just for the heck of
So
it. There's
it should be decided on the case to case basis. It should be
no
case to.
protocol for that. Yes, exactly. Yeah, for your dog.
Yeah. Can you give us like quick 3 tips for pet parents? 3 quick tips how they
Okay,
can handle dogs
my quick
for the
ones.
quick one.
Always know your 2 magic questions. Why are
Mm-hmm.
we doing this? And what if we don't? So that's my first one. Number 2, we touched on that. Always ask for all the records. X-rays, always have your records with you and create your health story. And then number 3 is the plan. Do you have the plan? Have you been clarifying what recovery, home care, if we're dealing with allergies, what food are we going to use next? Like, don't just think in this visit, like, what's the big plan on a big condition? Have a plan, not just, okay, I'll try this, and then it's like it all falls apart. Now what? Now you're going to see a different vet. Your vet is not there. So the plan. What is the plan?
And any 3 essential items they should always carry with them, whether it should be at home or they are traveling or anything. 3 essential items.
Well, I can I can make that super simple. For example, have poop bags with you. I've been caught. It's like, oh, what do I do here? Have poop bags. Always have high value treats with you to make sure you can get your dog back to you. And in terms of emergency, I'm a big fan of vet wrap. Vet wrap is
Mhm.
that self-sticky vet wrap and gauzes with me. And at the clinic, for example, we had a kit in case a dog escaped. If a dog, with the owner decided to run away, we had a kit ready to go. It had a leash in it. We didn't have poop bags for that, obviously, but we had a leash, we had high value treats, and then a little bit of an emergency kit if they get hurt. But to me, have your poop, you should be everywhere with a poop bag with your dog. Um, and high value treats, and do even mini training anywhere you are, a little bit of training as
Mhm.
well. And then vet wrap and some gauzes in case you've got a quick emergency.
And any medication you suggest which they can keep always with them?
Well, again, that's protocolized medicine. It's there's depending on your dog. If your dog has a lot of allergies, we may have to want this. If your dog is high anxiety, we may want to have something for sedation. Again, depending for each dog, we may, and definitely with, to me, if I do a prescription, it's like, and if people go away for 3 months to Mexico for the winter, make sure you have all the medications you need with you for your 3 months. I'm going to dispense way more for what you'll need for 3 months when you're there, because you don't want to say a new vet in a new country with
Mhm.
different ideas. So to me, be prepared for that.
Okay, so we are at the end of the webcast. So, where can pet parents, your hum program, first of all, I want to check with you. Will it be online or it'll be like all around the world? People can reach you?
Oh yeah, so I'm working really hard on it, and I'm hoping to have it done like by the end of the year, beginning of the year. So you will definitely hear about it, and it will be online for sure, and there'll be lots of noise about it. So until then, I mean, people can find me on Facebook, on LinkedIn, professional LinkedIn, on Facebook. I'm very active there, but then it's going to come out and you're going to hear about it.
And you have a message for the pet parents, the new pet parents, existing pet parents?
Enjoy every minute with your pet. There's such cherished moments. to be with them, and it goes by so fast. So enjoy every minute of it. It's a privilege to have a pet.
Thank you so much, Dr. Judith. Again, I want to thank you for taking out time for us. And of course, I think so. We'll have to get back to you with another episode, and we can do it once you launch Hum program.
Absolutely.
So we can do it a more detailed episode on that. But really, it was really insightful. The episode was really insightful, and it was insightful for me personally also. So I'm 100% sure our listeners also, will gain a lot of knowledge from
Well,
this episode.
thank you for having me. And I'm so glad to be able to share. I mean, I've been at it for a long time, 30 years. So every animal we can help makes such a difference. So thank you very much for giving me this chance to talk with you.